My name's Dr. Tim Ewer. I'm an integrative physician in New Zealand. I've been involved in integrative medicine for some 30 plus years. More recently, I've been getting interested in a particular form of cancer supportive treatment called SPDT, in addition to the other things that we do in terms of nutritional support, intravenous therapies, and so on. SPDT, which stands for Sono-photo-dynamic therapy, is where we bring together sound, usually in the form of ultrasound, photo meaning laser therapy usually, and dynamic means that we use an agent which helps sensitize cancer cells to the effect of ultrasound and lasers. And I've had the pleasure of going to some conferences now related to this and also talking with a number of other practitioners. What I want to do at the Genostics Cancer Congress is to introduce this theme, talk about where it's come from, where it's going. It's really quite exciting because there's a lot of new developments, both technologically in terms of lasers and sound, but also in the agents that we use, the photosensitizing agents, and using things like nanoparticles and various other ways of getting the delivery system going better. I'll also use it to illustrate through a case history how this can be used quite simply with quite dramatic effects. And I think this is what's really got me even more excited, is seeing how a relatively simple and reasonably benign procedure can lead to some dramatic effects in terms of cancer control. So this is what I'm looking forward to presenting, and I think you'll find it hopefully very interesting. And for me, at least, it's an exciting area of progress in cancer treatment. Thank you.
Thank you, Doc.